Hi, I'm Denise Siren with the Centers for Medicare and Medicaid Services. Welcome to Marketplace Matters, a series to help those who assist consumers with their marketplace questions. Today's subject, Medicare and the Marketplace. This information focuses on the individual marketplace and what consumers who have a marketplace plan and may soon be eligible for Medicare need to know to make informed healthcare decisions. The health insurance marketplace is designed to help consumers find and buy health insurance that fits their budget. But it generally isn't a place for someone eligible for Medicare to look for healthcare coverage. Medicare isn't part of the health insurance marketplace. This presentation will walk you through some questions that may come up when counseling consumers who have a marketplace plan and will be eligible for Medicare. Let's start with what happens when you have a marketplace plan and are eligible for Medicare. Jim has a marketplace plan and will be eligible for Medicare in 9 months. What does Jim need to know? Jim can keep his marketplace plan until his Medicare coverage starts, but if he's been getting tax credits or lower out-of-pocket costs on a plan he bought through the marketplace, these savings will end once his Medicare Part A coverage starts. He'd have to pay full price for the marketplace plan. Once he's eligible for Medicare, he'll have an initial enrollment period to sign up, which starts 3 months before his 65th birthday and ends 3 months after his 65th birthday. It's to Jim's advantage to sign up for Medicare when he's first eligible because if he were to enroll in Medicare after his initial enrollment period ends, he may have to pay a late enrollment penalty for as long as he has Medicare. In addition, after his initial enrollment period ends, Jim can only enroll in Medicare during the Medicare General Enrollment period from January 1st to March 31st each year. His coverage wouldn't start until July of that year, which may cause a gap in his coverage. He can visit Medicare.gov to learn more about his Medicare coverage choices and how he can choose to get his Medicare coverage. Can you choose marketplace coverage instead of Medicare? Ricardo is 65 and is eligible for Medicare. He likes his marketplace plan and wants to know if he can choose his marketplace coverage instead of Medicare. What does Ricardo need to know? There are a few situations where Ricardo can choose a marketplace plan instead of Medicare. For example, if Ricardo would have to pay a premium for Part A. In this case, he can choose a marketplace plan instead of Medicare, or if Ricardo's eligible for Medicare but hasn't enrolled in it and he's not receiving Social Security retirement or disability benefits because he'd have to pay a premium, or he has a medical condition that qualifies him for Medicare, like end-stage renal disease, but hasn't applied for Medicare coverage. If Ricardo is getting Social Security retirement or disability benefits, he'd automatically be enrolled in Medicare once he's eligible. If that's the case, it's against the law for someone who knows you have Medicare to sell you a marketplace plan. Before choosing a marketplace plan over Medicare, there are 2 important points Ricardo should consider. If he enrolls in Medicare after his initial enrollment period ends, he may have to pay a late enrollment penalty for as long as he has Medicare. And he can only enroll in Medicare Part B and Part A if he has to pay a premium for it during the Medicare General Enrollment period, which occurs from January 1st to March 31st each year. This means his coverage wouldn't start until July of that year, which may create a gap in his coverage. How do you cancel your marketplace plan once your Medicare coverage starts? Barbara is eligible for Medicare and her coverage starts next month. She wants to know how to cancel her marketplace plan. What does Barbara need to know? Once Barbara's Medicare coverage starts, she can cancel her marketplace health plan without penalty. She can do this by contacting the Marketplace call center at 1-800-318-2596 or canceling her coverage online. Now that Barbara has Medicare coverage, she's considered covered under the healthcare law. She won't have to pay the fee that some people without insurance must pay. Be sure Barbara doesn't cancel her marketplace plan before her Medicare coverage begins. Otherwise, she may have a gap in coverage. If you're a professional learning about the marketplace and helping people apply, you can get the latest resources at marketplace.cms.gov. You'll find resources for assisters, training modules, videos, frequently asked questions, and official consumer resources. You can also sign up to get email updates. Don't miss key dates and information about the health insurance marketplace. Here's how to stay connected.